Hey everyone, this is a quick follow-up. As I said last time I made a video, so the last time I saw the pain doctor, he prescribed me a reduced dosage. That was on Sunday. So I've tried my best. I've taken it as prescribed, the reduced dosage, and I have managed barely, but I'm in a lot more pain. I have a lot reduced quality of life and a reduced functionality. I've had to rest a lot more. I haven't been able to do much physically, and to the extent that I was managing and coping before, that has declined. So it's now Friday. Well, yesterday, Thursday, I called their office and asked to speak with the doctor, and they said that he's busy and they take a message and he'll call me back. That was in the morning. I called. Of course, I never heard from him. I didn't get a call back. And today I called again, and so then the MD is out today, not in the office on Fridays. So there's that. So then I spoke with the DO, who's the younger guy who saw me on Sunday, and I just told him the situation. And he says, well, I'm not willing to increase it because, as we discussed, I can't go above this dosage. I said, well, what about this? You mentioned to me that there's an alternative, which is a longer lasting, slower acting, and maybe that would work better. He said, I'll consider it, but, we got to wait till you come in on Sunday. It's illegal for me to send it in if I didn't see you. So first of all, that's bullshit. I don't know what he means by illegal. And I told him, I said, you saw me on Sunday, examined me. I did urine test, went through my whole history. And it's been just a few days, what new is going to be discovered by me coming in? He said, well, it's not that. It's just that it's illegal for me to send it in unless you come. And I said, I've had doctors call a modified prescription straight in. He said, okay, well, Hal, we'll do it this way instead. It's not our policy to do that. So he said, if you want, go back to your old doctor. And the way he said it was just so arrogant and condescending and dismissing. And I told him, no, my old doctor is not an option because they don't do any prescribing anymore. He said, fine, so you'll have to come in on Sunday, and if you're in a lot of pain, my suggestion will be go to the emergency room. That's everything. Also, and I don't mean to say this because I don't want this to sound the wrong way, because I'm upset, but honestly, everything laced with this haughty, condescending, like talking to a child. That's how he was behaving. And it's assumed, my wife tells me that maybe because he wants you to do another pee test, he doesn't want to prescribe anything without getting another urine test. So of course, I'm assumed to be a criminal or an abuser right away. My whole four-year history, almost 5-year history worth of medical charts and tests and trials of different treatments and everything, and injections and surgery don't really count for anything. It is assumed that I'm an abuser, and so he won't change my medication unless I go in on Sunday. So this dickhead is, I'm going to go in and I'll deal with him for as long as I need to, but obviously, this is not somebody who's interested in treating me. This is somebody who's interested in just keeping the minimum and getting their regular visits. He doesn't give a shit that I'm in pain. He doesn't give a shit that I had a better quality of life before and that he has reduced my quality of life with his restriction. So there's really nothing to be gained because I'll have to manage, but it's not good enough because I was better off before with a doctor who was prescribing a higher dose, and so his attitude that it's just not acceptable is crap because he explained because you develop tolerances and everything. I'm not worried about what's happening years down the line. In order to be cautious of a long-term potential loss of efficacy, he's creating an immediate guaranteed loss of efficacy, which is ass backward and stupid and not in my best interest and not in the best interest of treating my condition now. It's BS. There is no rationale for it. It doesn't make any sense. Other than, hey, the translation of all this is on his point of view is, hey, I'm afraid I can't treat you with any more because they could just hunt me down and take away my license because some suit who's not a doctor and has no medical training has made a decision based on political needs, nothing to do with treating pain and healthcare. So that's just an update, just because I want people to understand that if you suffer from chronic pain, number one, you are always assumed to be a criminal unless you go to great lengths and comply with a bunch of ridiculous restrictions to week by week, month by month, prove that you're still not a criminal, because you never trusted. You're only trusted for that, to make a prescription, and then the next time you need one again, you're back to the default criminal status. So that's what you have to deal with when you're in so much pain that even getting into a car for a 10-minute car ride is painful and excruciating, and usually takes a day or two to recuperate from. But you have to do it because you're not allowed to have pain relief from medication without going through this process. That's where we stand. So to everybody and anybody who watches this video or follows what's going on with opiates and everything, you better hope, I hope, that you never develop a condition where you have chronic pain, because you will learn the meaning of oppression, the true meaning of oppression, being treated with suspicion, mistrust, derision, and being treated like you are a criminal, you're violating rules every minute, unless you pass these series of tests and you go by a series of strict regulations just so that you get pain relief for a while longer, and then again back to the beginning of the cycle. This is what you have to go through. If this were the case with any other medical conditions, more common medical conditions, this would not fly. There would be the most ridiculous backlash from it. But chronic pain is common, but it's not nearly as common, or it doesn't draw as much attention as something like cancer or AIDS or leukemia or anything like that. So we're just kind of washed away in the gutter when it comes to like priority and getting exposure, getting advocacy. We really don't matter that much. And so I just wanted to follow up and let everybody know where it stands now. So now I'm back to square one, trying to have to find a doctor who's willing and able to actually treat me. The problem is that if it continues this way, I'll have to resort to what a lot of people resort to, getting medication on my own way, and that's supposedly what they're trying to fight by making these restrictions. And of course, they're just going to create more people doing that, because when it comes to a choice of doing that or just suffering and being in bed all day and having barely any quality of life, the choice is just, it's a matter of taking care of yourself. It's a matter of survival. There really isn't any question. And right now, the medical system demands that people like myself suffer from pain rather than get pain relief, because, or at least rather than get proper, adequate pain relief. It's the best term to use is adequate, because there are other people who get this medication and either abuse it for recreational purposes or addiction, or sell it. None of which I've ever done in my life, but of course they don't care about that. That doesn't matter. The point is, let's just restrict everybody's access to it so that we create the public illusion of making positive changes, and so that the people who are doing this get to I don't know if it's funding for their agency or if it's political points to keep their position or whatever it may be. There's a lot of opinions. I honestly don't know what the exact purpose is, but there's a lot of opinions. But the one thing that it isn't doing and that it isn't intended to do is to care for patients, the people who suffer from chronic pain. It is knowingly neglecting us and without any concern to try to address that at all. So it's just an FYI, and I'll see you next time. Thanks for listening.